Our next speaker is Dr. Looi E, who heads up the tube feeding program at the Royal Brisbane. You will know that tube feeding is something that you avoid, but sometimes you just have to. So please welcome Dr. E to tell you a bit more about it.
Thank you to the organisers for inviting me to speak. Obviously, I'm talking about the pointy end of the kids, because most kids, if we can try and avoid it, we should try and avoid tube feeding. Now, the concept of tube feeding, though, is actually not new. This is a slide that I borrowed from Jeff Cleghorn to show that back in 1888, someone was having a gastrostomy feed. So now, when somebody gets sent to me for tube feeding, there are quite a lot of disadvantages. So these are the things that cross my mind when you send me someone. The first thing is, I know that as soon as we start tube feeding, you can't control their intake, they'll lose their hunger drive, they'll reduce their appetite and their motivation to eat, their oral stimulation is reduced, there is a significant risk of developing oral aversion, and they will get local irritation of either the nose, the skin, or from a variety of tubes. Now, having said that, though, there are some advantages. It allows you to nutritionally boost their intake, and that's really the main reason for tube feeding. You can regulate how much they're actually having, you can calculate accurately what they're having, and also you can actually use it for medications and also for fluids, particularly when they're a bit unwell.